Schizophrenia is more than psychosis. It affects around 1% of the population. Between 25 to 50% of schizophrenia patients attempt suicide and 10% eventually succeed, contributing to a mortality rate of 8 times greater than that of the general population. Now, life expectancy of a patient with schizophrenia may be 20 to 30 years shorter than that of general population. Not only due to suicide, but in particular due to premature cardiovascular disease, caused not only by genetic and lifestyle factors such as smoking, unhealthy diet, and lack of exercise leading to obesity and diabetes, but also from treatment with some antipsychotic drugs which themselves cause an increased incidence of obesity and diabetes and thus increased cardiac risk. Schizophrenia by definition is a disturbance that must last for 6 months or longer, including at least 1 month of delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms. Now coming on to positive symptoms of psychosis and schizophrenia. These include delusions, hallucinations, distortions or exaggerations in language and communication, disorganized speech, disorganized behavior, catatonic behavior, or agitation. Now these can erupt suddenly when a patient decompensates into a psychotic episode, often called a psychotic break, as in break from reality. Now coming on to delusions, these are a type of positive symptoms and usually involve misinterpretation of perception or experiences. The most common content of delusions in schizophrenia are persecutory, self-referential themes, somatic, religious, or grandiose. Now hallucinations may occur in any sensory modality, that is auditory, visual, olfactory, gustatory, or even tactile. But auditory hallucinations are by far the most common and characteristic. Now distortions and exaggerations in language and communication, that is disorganized speech, as well as in behavior, that is grossly disorganized, catatonic, or agitative behavior may also occur. Now coming on to negative symptoms. The first one is alogia, that is poverty of speech. That means talks little or uses few words. Now the second one is affective blunting, that is reduced range of emotions in perception, experience, or expression. For example, the patient might say that he feels numb or empty inside, may recall very few emotional experiences, good or bad. The third one is asociality, that is reduced social drive and interests. In this, patient has little sexual interest, has few friends, and shows little interest in spending time with them. The fourth one is anhedonia, that is reduced ability to experience pleasure. In this, the patient finds previous hobbies or interests as unpleasurable. The fifth is avolition, that is reduced desire, motivation, or persistence. In this, the patient has reduced ability to undertake and complete everyday tasks and even may have poor personal hygiene. Although this reduction in normal functioning may not be as dramatic as positive symptoms, it is interesting to note that negative symptoms determine whether a patient ultimately functions well or has a poor outcome. And thus, negative symptoms determine whether a patient with schizophrenia can live independently, maintain a stable social relationship, or re-enter the workplace. Now, negative symptoms are not just part of the syndrome of schizophrenia, but they can also be a part of the prodrome. That begins with subsyndromal symptoms that do not meet the diagnostic criteria of schizophrenia and occur between the onset of the full disease. And thus, these are very important to detect and monitor over time in high-risk patients so that treatment can be initiated at the first sign of psychosis. And finally, the negative symptoms can also persist between psychotic episodes. Now let's discuss key negative symptoms that can be identified solely on observation. The first one is reduced speech. In this, the patient has restricted speech quantity, uses few words and non-verbal responses, has impoverished content of speech where words convey little meaning. The second one is poor grooming. In this, the patient has poor hygiene, his clothes are dirty or stained, or the patient actually has an odor. The third one is limited eye contact, in which the patient rarely makes eye contact with the interviewer. Now coming on to key negative symptoms that can be identified with some questioning. The first one is reduced emotional responsiveness. In this, the patient exhibits few emotions or change in facial expression when questioned and can recall few occasions of emotional experience. The second one is reduced interest. In this, the patient has reduced interests and hobbies. There is little or nothing that stimulates his interest, and he has limited life goals or an inability to proceed with them. The third one is reduced social drive. In this, the patient has reduced desire to initiate social contacts and may have few or no friends or close relationships. Now, instituting treatment for negative symptoms during the prodromal phase of schizophrenia may delay or prevent the onset of the illness, but is still a matter of current research.